Respiratory development follows a highly ordered embryologic timeline. Upper respiratory structures form first, beginning with invagination of the olfactory placodes around week 4. The laryngotracheal bud appears by week 5, and by the 8th week, the mucosa of bronchi and alveoli are present. Despite this early structural development, the lungs remain non-functional for gas exchange throughout fetal life. Although airways form early, functional gas exchange is delayed until late gestation. Surfactant production increases significantly in the final 2 months of development of pregnancy, allowing alveoli to remain open after birth. Prior to delivery, though, the lungs are fluid filled and pulmonary blood flow is minimal. That's why we have all those cardiac shunts that we learn about. As oxygenation occurs via the placenta, there's no need for our lungs to oxygenate the body, nor could they. They're in fluid in gestation. This explains then why a premature infant is particularly vulnerable to respiratory failure or lung complications. At birth, a dramatic physiologic change occurs. The first breath clears fluid from the alveoli, and pulmonary vascular resistance drops, and then blood flow through the lungs increases. Respiratory sensors in the brainstem become active in response to rising CO2 levels. Full lung inflation takes approximately 2 weeks, and respiratory rate is highest in newborns and will gradually slow over time to adult values, which is less than 20 respirations per minute. Lung development will continue into young adulthood, and additionally, alveoli form and surface area continues to increase. Peak respiratory efficiency occurs early on in adulthood, and after which gradual declines in elastic recoil, chest wall compliance, and muscle strength occur. And these age-related changes reduce ventilatory reserve and explain increased susceptibility to respiratory illness in older adults. That's the end of this lecture. We will come back and talk about further pulmonary ventilation and processes next, but this gives you an overview of this organ system and its main functions.